Yes, see the CEO of Tamale Teaching Hospital now. Yapamono. Adechi John Mohammed, a new person. Thank you very much, Mr. President. Thank you.
So the Minister of Health paid a surprise visit to the Tamale Teaching Hospital a few days ago. Some things didn't go well and a doctor was sacked. The Doctors Association of the Tamale Teaching Hospital did not agree with the minister for sacking their colleague because they believe that most of the things the minister think were going wrong in the hospital were not the fault of the doctors. The Doctors Association of the Tamale Teaching Hospital has since indefinitely suspended OPD cases and emergency cases in the hospital. So if you are around Tamale and you are visiting the Tamale Teaching Hospital, advise yourself. The Doctors Association of the Tamale Teaching Hospital has given a long list of demands that need to be met before they can go back to work. This includes an unqualified apology from the Minister of Health and the Tamale North MP to the management of the hospital, constant supply of water, constant supply of electricity, constant supply of oxygen, constant supply of gloves, nose masks, and many other things before these doctors can go back to work. Alright, so now the question is, do they have to sack somebody from your hospital before you come out to let people know that, okay, you don't have this, you don't have that? What were you doing? The management of the hospital, what were you doing? You knew you don't have all these things. What were you doing? You sat down there. Every month you go and take your salary, but you knew that you don't have the things you need to work. What did you do? How were you taking care of the patient that's come to your hospital? How were you treating them? How were you handling them? So you were just doing anyhow. When somebody comes there, you do anyhow, you do anything and let the person go. Whether the person die or the person survive, you don't care. That's what you were doing. Because you are saving lives. You don't have the things that you need to. Why did you not talk? Why did you not let people know? You kept quiet till they sack somebody, till they sack one of you. Then you start complaining. You start giving a long list of things that you need to be done before you can go back to work. I mean, why? Do they have to sack someone before you come out to complain? Do you come out to let people know that you don't have these things? Why? Had it been that they have not paid you 1 month, you would have all come out to complain. But something is not in the hospital. You need something to take care of sick people. You kept quiet till they sack one of you. Then you now come out to give long list of things that you don't have in the hospital to take care of sick people. Why? You are defending your colleague because he has been sacked for misbehaving in front of a minister. Anyway, so if you are going to the Tamale Teaching Hospital today, be informed.
Copy to the Minister of Health too. They say, one, following our earlier press release today, the Doctors Association of Tamale Teaching Hospital, they held an emergency General Assembly meeting at 12 noon, and the outcome of this meeting is as below. And that will immediate effect. All members of the Doctors Association of Tamale Teaching Hospital have proceeded on an indefinite suspension of all emergency and outpatient services, general OPD, antenatal clinic, specialist clinic, and pediatric OPD as well. And these are their demands. Unqualified apologies from the Minister of Health and the Member of Parliament for Tamale North constituency should be rendered to Dr. Valentine Akupa. Second, we shall resume provision of emergency and outpatient services after we receive appropriate apologies. Third, the management of the hospital shall ensure that the following are available in the short term for us to work effectively. A, constant flow of water through the taps for clinical work. B, stable electricity supply in the hospital. C, constant supply of oxygen. D, provision of consumable items such as gloves, gauze, cotton, face masks, cannulae, sutures, syringes, disinfectants, glucometer strips, plaster. They don't have this?
It's short sometimes.
I see. E, constant supply of reagents to ensure continuous availability of essential laboratory tests within a hospital. They don't have that? 100 continuous vital signs monitoring devices for all high dependency units in the hospital, 4 ventilators at the accident and emergency department, 4 ventilators at the intensive care unit, 2 ventilators at the pediatric emergency ward, 2 ventilators at the neonatal intensive care unit, 2 ventilators at the maternal intensive care unit, 2 transport ventilators, 2 transport incubators at the obstetrics and gynecology departments, service and repair of the 1,000 liter autoclave machines at the CCSSD. Now it says that in the medium term, the following must be provided to facilitate our work: an MRI scan machine that does not use helium, a CT scan machine that has an infusion pump, a mammography machine, a fluoroscopy machine, okay, a C-arm machine at the main theater, ABC machines in all intensive care units, and 2 mobile X-ray machines. 5, the Doctors Association of Tamale Teaching Hospital will continue to engage management to ensure that the aforementioned in points 3 and 4 are available for health delivery. We shall advise ourselves if there is failure to achieve the above within the shortest possible time, that should any of our members feel threatened at any point in the provisional service within the hospital, they shall immediately remove themselves from such hostile environment for their safety. Lastly, he says that all media houses that release false and biased reportage of the incident at the Tamale Teaching Hospital accident and emergency during the health minister's visit should render apologies to the Doctors Association at the hospital on their platforms. The Doctors Association shall not engage these media houses until this is done. I hope Joy News is not one of them, because we didn't report false information.